Good afternoon, everybody. Happy Thursday evening. Once again, I pray that all of you are safe, sound, and virus-free. I had a person who commented or asked a question about hydroxychloroquine again. The person stated that he thought hydroxychloroquine was effective during the SARS outbreak in 2002, early 2000s. And we really didn't have as many cases of SARS then as we do now. But I think the important point of this is SARS-CoV-1 was also a virus in the coronavirus family. SARS stands for serious acute respiratory syndrome. And it just so happens that SARS-CoV-2 is also causing a significant acute respiratory disease. And so we call that SARS-CoV-2. But even though they're in the same family, SARS-CoV-1 and SARS-CoV-2 are two different viruses. So what may have helped with one doesn't help with the other. For example, if I could correlate that with bacteria, there's not one antibiotic for all bacteria. Some antibiotics work for one member of a bacterial family, other antibiotics work for another. So although both were coronavirus family members, SARS-CoV-1 and SARS-CoV-2 are two different entities. What may have worked for SARS-CoV-1 doesn't necessarily mean it's going to work for SARS-CoV-2. Okay, names are similar, same family, but two different virus particles. The other thing I want to mention, we're little by little, or fairly quickly and fairly soon, more and more places in the United States and around the world are opening up, relaxing restrictions. We've been hearing about protests in the United States. And it's because of all the economic issues that this virus is causing. And it's understandable that people are getting anxious and antsy and want things opened up. There's more than one aspect to this virus. Right? I will continue to speak about the medical aspect of it. And there's a political aspect. There's an economic aspect. And those three issues sort of overlay each other. There's a behavioral aspect, there's a political science aspect. All those issues do have some overlap. But at this point, without having a vaccine and without having treatment, we are taking a risk by opening things up earlier than a vaccine is available, and not taking precautions such as facial coverings and social distancing while we're opening up can cause that virus to start spreading faster. There are places in the world now that are realizing that. There are countries in Asia and Europe, or areas of country, that are now restarting restrictions because they're realizing that they did open up at a time they thought was appropriate, and the virus is starting to build in numbers again. It's starting to spread again. And so they're being pressured to now shut things down again. You've heard this is called a novel virus. It's novel, meaning it's new. We don't understand it, and we still don't understand it completely. We don't know how it's going to behave in the summer in the United States. We don't know for certain what's going to happen this winter as the influenza season comes in also. But the medical understanding of it, the best understanding that we have of it, is that this is not going away. Anytime soon. And the likelihood, and I, as I stated in other lectures, if it's not medically proven, I'm going to tell you that it is an opinion. It is a medical opinion that if we open everything soon, too soon, and people are not taking precautions, facial covering, social distancing, a lot of washing, we're likely going to see very high numbers of this virus. So there is a financial need to reopen things. That doesn't take away our ability as intelligent human beings to wear facial coverings and maintain social distancing to the best of our ability. Other countries are realizing that they may have to shut down again. We may realize when we open up things that we'll have to shut things down again. We know nothing for certain about this virus. I will continue to give you the facts as we understand it, the medical community. The fact is that this is a virus that spreads easily. We have no vaccine to prevent it. We have no medication to treat it. Everything is still under investigation about prevention and treatment. Most people who get it won't die. The people who die usually have pre-existing conditions or are over 65 years of age. And that 50% of people with COVID-19 are carriers and may have no symptoms. The virus is deadly. Those are the facts. We've known for a long time how to prevent a respiratory virus from spreading. And that's by shielding yourself if you're coughing, sneezing, etc. Because of the carrier status and because of the fatality associated with this virus, it has been recommended by multiple sources to cover with a facial covering, a cloth facial covering, when you're in public, when you're within 6 feet of someone. Maintain social distancing. And a lot of soap and water, because we know that soap kills this virus. You know, we don't know when a vaccine's coming out. When it does, I'll let you know. But until that happens, we need to be real careful about what we do. because the most healthy of us in the community are only going to be carriers. And the most healthy of us who are carriers are going to spread it to the weak. And those over 65 years. And they're the ones who will be hospitalized, and they're the ones who will die from it. I ask you all who are hearing this, continue to shelter in place to the best of your ability. Continue to wear facial coverings should you be within several feet of someone. And if you end up in a store or another place where someone within 6 feet of you is not wearing a facial covering, walk away from them. I'm not asking you, I'm asking you not to shame them, not to point them out, not to lecture them. Walk away from them. They don't understand. They don't get it. In this country, we're not doing very well with this virus. You don't have to be a victim to it. And the only way you're going to catch it is to be near somebody with it. And the person you catch it from will be a carrier who is not wearing a facial covering, most likely. You don't have to be a victim to that. I will ask you for one more favor. When you do walk away from them, say a prayer for them, because they don't understand. They don't understand what they're doing. They don't understand what they're doing to the elderly in the population. They don't understand what they're doing to those who are vulnerable. They don't understand what they're doing to those who are receiving treatment for cancer who are out in the community. They don't get it. But if you get it, wear a mask, wear a facial covering, social distance. And please don't be a victim to somebody who's not wearing a facial covering. And say a prayer for them. Good night, everybody. We'll see you tomorrow evening.